Okay, so we'll take a quick look at glycosuria. Glycosuria is any the presence of reducing sugars in the urine, and the most common reducing sugar that you find in urine is glucose. Now you know that the reducing sugars are glucose, galactose, and lactose. But the most common that is more of clinical importance is the presence of glucose in urine. So we're going to focus on glycosuria. Now, glycosuria is the presence of glucose in urine, and this is the most common type of glycosuria. Urine normally contains glucose, but they are usually not detectable by our conventional measurement methods like the urinalysis dipstick technique that we normally use. Now, it's not that for those urine that come out negative using the dipstick method in detecting urine in glucose, it's not that those urines don't have glucose at all. But the issue is that the glucose level in our urine generally for a healthy individual are usually non-detectable by those dipstick technique. But if we want to measure glucose by certain specialized techniques, we'll be able to measure glucose in their minor quantities in urine. So glycosuria is the presence of, or glycosuria is the presence of detectable amount of glucose in urine using our conventional methods. So now what could be the cause of glycosuria? Now glycosuria can be caused by various reasons, but we mainly focus on two most common reasons why you could find glucose in urine. So now, the two primary or main causes of glucose in urine include one, high blood glucose level. When blood glucose level is high, it gets high to a point that the blood glucose level will be able to transverse the high glucose will be able to enough quantity of glucose will be able to transverse the kidney and find itself into the renal tubes, and then the rate at which it is transversing the kidney is high compared to the rate at which the renal tubules will be able to reabsorb the glucose. And so because of that, glucose will be lost into the urine, and then you find glucose in the urine. And we know that the renal threshold of glucose is 180 milligram per dl, or 18 or 10 millimoles per liter. So once glucose is as high as 180 milligram per dl, that means it has gone beyond the ability of the glucose to hold it back from escaping into urine. And so with that, glucose will now be detectable in urine. So in diabetic individual who have uncontrolled glucose level, their glucose level are not within control, are not being well controlled, you can find their glucose in urine, you can find glucose in their urine. So that means it's possible for an individual to be diabetic and there will not be glucose in the urine of that individual. So that means the glucose of that individual is well managed. So high glucose level is one major cause of glycosuria. Now, another cause of glycosuria is a renal failure, particularly a failure in the renal tubules to be able to reabsorb glucose, after it has passed through the glomerulate or glomerulus rather, into the glomerular filtrate. Normally, the glucose that the glomerulus has filtered is able to be reabsorbed back into circulation with a functional tubule. But when there's a dysfunction or there's a malfunction in the renal tubules, it can result in the escape or the loss of glucose into the urine. Now, in the difference between both conditions is that like glucosuria results from high blood glucose occurs in diabetic individual. However, glucosuria that results as a result or that results from a failure in the functioning of the renal tube is found in non-diabetic individuals. So the difference is that in diabetic individuals, you will measure glucose in both urine and in blood. But in non-diabetic individuals that are having glucose in urine as a result of renal failure, when you measure glucose in blood, glucose will be normal or even low at times, but glucose in urine will be high. In that case, you understand that the challenge is not that the person has accumulated glucose in the blood. No, the challenge is that is the inability of the kidney to effectively reabsorb glucose that has been able to transverse the glomerulus to find itself in the urine. Now, also, glucose can be found in the urine of some pregnant women, and so that's you can find them in even though they do not have gestational diabetes, but sometimes you will find trace of glucose in their urine because of the changes in going on in the body of that individual. There can be some level of impaired glucose tolerance in that individual. Then it can be also pressure on the kidney affecting the ability of the renal tube to effectively reabsorb. But overall, there is glycosuria. So that's it for glycosuria. And glycosuria can simply or easily be diagnosed by the measurement of glucose in urine simply by the dipstick technique. That is, and the dipstick technique is not a quantitative assessment, but a qualitative assessment because the dipstick technique, what it simply does generally is that it measures glucose, whether glucose or any other biochemical component is present or is absent in the urine sample. The one that is only specific in the dipstick technique is the specific gravity and probably the pH. So that's it for glycosuria.